Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join us as we interview renowned thought leaders, medical doctors, and biohackers, interesting people of all sorts. Each week, I bring to you the most interesting and important information for your health, for optimization, and for longevity. Today is no different. I am super excited to talk about maybe the one of the most, maybe the least known powerhouses for helping your immune system. In the era post-COVID, I find, at least in my clinical practice, that a lot of people are suffering from cancer, immune issues, chronic infections, chronic complex conditions. And I won't go into all the details yet. You'll hear about that in my interview, but I just want to say you want to stay tuned today because there is a powerful nutrient that you may be missing in your supplement regimen that is one of the most powerful things you can do to support immune system and even to fight cancer or prevent cancer. So stay tuned. We're going to be interviewing Dr. Chris Diamando, and I will introduce him in just a moment. Before I do, I always like to tell you guys about what's going on with me, a couple little blurbs. First of all, if you have not yet ran over to drpatientmovie.com and watched the documentary, it's now streaming on Amazon Prime. Please take a peek. It's about 75 minutes long. You can also just watch the trailer for 2 minutes if you want to just get a sneak peek and see if it's of interest. I've been getting incredible feedback from you, all of you who've been watching it. It's now also available on Amazon Prime in Europe. So if you're in Europe, you can watch it there as well. And it's drpatientmovie.com for a link to all places. It's also streaming for free on YouTube and Tubi, so you don't even have to pay to watch the movie. So check out drpatientmovie.com. And if you have not jumped over to drjillhealth.com, I've curated a variety of great products and services for you there. All of the best quality nutrients for your regimen, just for longevity, optimal performance, optimal gut health. You can search those topics and find some of my favorites. And if you haven't yet taken a peek at some of the cool stuff I have at drjillhealth.com on beauty, this is one of my very favorites. It's Age Reversal Neck Cream. And you can get this at drjillhealth.com. Just look up the Age Reversal Neck Cream. I've been having more and more women. It's funny, I'm in my 40s and we can take care of our face and provide sunscreen, but I think our neck and this area often really tells our age. And I've been using this for a year and really noticing the difference in the lightness and brightness of my neck. So this is called Age Reversal Neck Cream. Check it out at drjillhealth.com. And that's DRJILL health.com. Okay, let me get to the introduction. Dr. Chris Diamano is a research scientist and assistant professor at the University of Maryland School of Medicine, where he focuses on how lifestyle choices and environmental exposures impact health across the lifespan. He formerly served as director of research at the University Center of Integrative Medicine and has led numerous clinical trials and studies on nutrition, supplements, exercise, stress management, and health coaching. He has authored over 100 peer-reviewed publications, contributed to leading medical textbooks, and speaks internationally on integrative and lifestyle medicine. He serves as scientific advisor to several organizations and companies in the natural products industry and frequently featured on many media outlets. You are going to love this interview. So let's welcome Dr. Chris. Chris, I'm so excited to have you on the podcast. I do so much with toxic load, infectious burden, and all of these topics that we are all so familiar with and seem to be getting worse. But because these intersect at immune system, what I really am excited today to talk to you about is our immune system and specifically how beta glucans can really be a powerhouse. And I always on the podcast learn something from my guest. I know this will be no different. I'm so excited to really dive deep so that I understand the mechanisms. Before I do, though, I always love to ask my guests a little bit about their story. Like, how did you get into this world? What is your background? And how did you kind of get to be a really an expert on immunology and beta glucans and this kind of science?
Yeah, awesome. Well, first, pleasure to be here with you. Look forward to our convo today. I really think beta glucan is the most underappreciated tool that we have, when it comes to supporting our immune health. But as far as how I got into it, I mean, like many in our field, it was a personal connection. So I had very long-lived and vibrant grandparents with whom I was very close. And one in particular lived to be over 100 years old and was like lifting weights and playing golf and tennis like deep into his late 90s. And he was an inspiration for me. And he attributed it to like, his diet, his exercise, and some of these things that I was just learning about at the time. So I went on and got a doctorate in epidemiology where I focused on nutrition and aging. So I wanted to bring the methods because we didn't know a whole lot about that type of thing, at that point in time. I think we're still learning more now, obviously. Now, beta glucan was actually even more personal as my own person. So I was an athlete and was pushing myself pretty hard, like deep into my 20s, in the gym. I was doing martial arts and playing basketball and these things, and I was getting colds constantly and like these just getting picking things up that I had never really picked up before, and was looking for ways to support my immune system and sort of dove into the literature on how could I do that. And beta glucan was one of the ways that really was able to tap into supporting my immune system and, you know, stopping all these infections. Now that I have a toddler too, it's even more important to safeguard where we can. So that's the story how I got into this field and functional medicine in general, root cause medicine, integrative medicine. Spent quite a number of years at the University of Maryland School of Medicine, directing the research at the Center for Integrative Medicine, working with
Wow.
IFM, now Elevation Lab, and just looking, have enjoyed working with so many in this space and learning and working and even into my own life too, as long as the patients that we've worked with.
I love that, Chris. And again, our paths have kind of crossed in ways, and yet I haven't really got to sit down and really get to know you. So today I'm super excited to do that along with the people listening to the podcast. A couple of thoughts interesting from my perspective. I've known beta glucans as a powerhouse, especially in our complex chronic, like patients with chronic infections like Lyme or mold related illness. And one thing, again, I'm going to learn today way more about the science, but what I've seen in clinical practice is any type of chronic infection, especially, you can never just treat it with antibiotics or herbs. You always need the person's own immune system to be involved. So, one of the things that I always tell them is we need to get your immune system engaged in the process because if we don't have your immune system helping us out, we're not going to get it through that with just hitting it on the head like whack-a-mole, right? And often patients have more than one infection, so we need to not just target each infection, but this immune system. And so what I've known in the field is there's certain products, and every one of them contains beta glucans of some form. And we're going to talk about even quality of different products and things in a few minutes. So you can tell us kind of what the best things out there are. But first, let's set the stage because many listening are just like, what's beta glucan? What is this? So maybe just like what's the molecular structure, basics, and then how does it even work? Like, why is this such an immune powerhouse?
Okay. Yeah, it's striking to me that people in our field even don't recognize, and
Yes.
given the science that there, I mean, thousands of studies, hundreds of clinical trials, we just don't, I think the recognition hasn't been there yet, and hopefully we can help with
Yeah.
that today and beyond. So beta-glucans are polysaccharides, which just means that they're, chains of complex carbohydrates that are found in a lot of foods and natural products. So things like mushrooms, seaweed, certain grains, oats, and yeast, and they're in the cell wall of those foods, and they have these potent immunomodulating properties. And there's different forms of these. There's based on their structure. It's actually quite a big and complex set of molecules. But there's ones that have what they call 1,3 linkages, and this is important for viewers to understand what these different products are going to do.
I've always seen on the label, is that the one dash or comma three
Yes,
beta glucan? So that is
exactly.
okay.
Exactly. And you'll see 1-3, you can see 1-4 and 1-6, and they all have different properties. In some cases, quite different properties. So it's key to understand what they do. So the 1-3 linkages, the 1-3, are where a lot of the immune function is, like with the immunomodulating properties. And we can talk about mechanisms a little later on if you like, because there are some that are actually specific. In fact, there are receptors on immune cells that are really essentially specific to beta glucan, which is really fascinating. So that's the 1-3. The 1-6 is not as involved in the immune system directly, but it works with, so the 1-6 and 1-3 work together to sort of optimize immune health. Then you have, so those are insoluble forms. Then you have the 1-4, which is a whole different ball of wax, really. That's not as much, really not really much, measurable immune activity. But what that tends to do is more on heart health. So if you've seen, studies, we'll talk about some of them today that range from, fighting respiratory tract infections or cancer, and then okay, also lipids and triglycerides. Like that's kind of interesting, two different, very different
Yeah.
things. That's the 1-4. So those are
Okay.
more on that cardiovascular side. So that's sort of the breakdown on the structure in a pretty simple way, I hope.
Oh, that's super helpful because again, I've seen those on the labels, and if clinicians are watching or patients are pulling their product up and saying, "What kind do I have?" Now, one thing I've noticed, it's interesting because we both have a background with the functional medicine realms, and what I've thought, I mean, whether it's rheumatology, neurology, gastroenterology, a lot of us as functional generalists kind of live in all of these worlds. But honestly, I think maybe the most important path is immunology, like really understanding. And the more, I think probably the explosion of the microbiome innate immune system data, I can't think of any more important area of medicine than immunology. And I have had to become a kind of honorary immunologist and understanding, toll-like receptors and dendritic cells and all of these things. And I frame it because now in functional medicine, in my most complex patients, we're doing tests to determine T cell function, CD4, CD8 cells. We're determining natural killer cell function, and we're looking at, and there's ways to look at numbers and function and all these things. And we don't have to go into that. But maybe we talk just a little bit for those who are kind of in deep of this is natural killer cells. There's a start there because those are a big one for fighting cancer. And in patients that have chronic Lyme in particular or chronic infections, they tend to be a big deal in that patient being able to overcome. And years ago, as functional medicine doctors, we would even look at the number of natural killer cells. If it was below 50 absolute, we'd say you're less likely to overcome this. Now, I don't know how true that is. I don't really count natural killer cells as a key indicator. However, they're a big deal. Do you want to talk about maybe that and any other cells that are directly impacted by beta glucans?
Oh, absolutely. Yeah, the natural killer cells are one of the big ones. And I'll actually pull up an image for you. I'm
Sure.
glad you brought that up in a few. But yeah, from a high level perspective, they are, referred to as like the natural born killers of the
Yes.
immune system. So
Right.
part of that, innate immune defense of that first line of defense. So we know we got our innate immunity
Yeah.
and our adaptive immunity. Innate is like, what happens first,
Yeah.
short term, and then adaptive is more learned, things more like antibodies and so on. But natural killer cells are part of that innate immune system, and really just go after pathogens, and other, all kinds of antigens, tumor cells, infectious agents, and so on and so forth. So they're a key part of that. And in fact, I'll
Oh,
show,
perfect.
I'll pull up a slide here just to kind of visually walk through how this works
Perfect.
with both in general and then specifically with beta-glucan. So actually, it's a pretty good time even to talk about these receptors that are on immune cells. So there we see a monocyte. So we see beta-glucan, as I mentioned, it's a big complex structure. It binds to these sites on immune cells, including monocytes. So we see CR3 there and dectin-1. These are essentially unique to beta-glucan. CR3, in fact, was initially called the glucan receptor because biglucan was what activates it, what binds to it and activates it. So when biglucan comes along and binds these receptors, for instance, this is one of the mechanisms. This will increase the secretion of IL-10, which then, there's receptors in the natural killer cells, which activates the natural killer cell to go after and kill whatever that pathogen is. So this shows part of this pathway. I will take this off here and then talk a little bit some other ways that it works. So with macrophages and other ones, and so those are involved in phagocytosis again by binding to these receptors, the CR3 and dectin-1. It will activate the macrophages for phagocytosis, which essentially just
All
engulfs
seen. Yeah.
pathogens, yeah, and gobbles them up, Pac-Man style. So these are some of the ways that this works. So this production of different cytokines, phagocytosis, enhancing natural killer cell activity, which is one of the reasons why the effects on the immune system are pretty broad with this. A lot of times things can be a little bit more targeted, but when we look at different kinds of cancers, even, I mean, a lot of times, different cancers are
Right.
different disease processes, but when you broadly modulate the immune system like this, you will have some of the benefits that we've seen in clinical trials.
Mm. So I love that. And just to reiterate, so the more I've known about beta glucans, the more when I have someone with active cancer, I have them usually on beta glucans. Are there any, this is just a side path, but I know that some of our disease states, like maybe like inflammatory bowel disease, can be an upregulation of part of the immune system. Is there any contraindications of any certain conditions that we might not want to upregulate natural killer cells or the immune system?
Yeah, that's a great question that comes up quite a bit. I mean, the one situation clear is if people are on immunosuppressants, then you would want to stay away from
Of
this.
course, yes. So like organ transplant patients. Yeah.
Absolutely. Yeah, there's been some interesting data because like biologically, it's biologically plausible that, hey, do we really want to increase the activity of natural killer cells in a situation where there's already kind of heightened immunity? There's been some recent papers that have actually shown that beta-glucan can assist
Yeah.
with autoimmune conditions. And part of this is likely due to the impact of trained immunity, which is a pretty interesting topic and I'm not an immunologist either. I'm an epidemiologist, but I've
Uh-huh.
sort of, like you, had to learn this, I think, to really understand the way a lot of these products work. But with that, it's a form of, a moment ago, I said innate immunity is what happens over the short term, and it's really not specific. Trained immunity is, when there's some kind of exposure to some kind of stimulus, including, but not limited to, beta glucan, the innate immune system essentially becomes reprogrammed in a lot of ways. And this occurs through epigenetic mechanisms, so modification of histones, and through metabolic, so enhancing glycolysis. And what this ends up doing functionally is that these innate immune cells that I was talking about, the macrophages, the neutrophils, natural killer cells, they are reprogrammed and in a non-specific way over a fairly long period of time. Not as long as you would have for adaptive immunity, which is specific, you get antibodies to a certain pathogen. But what's cool about that is that it will just sort of, in a lot of ways, just reprogram the
Yeah.
immune system in an advantageous way to better respond to pathogens.
Hey guys, want to interrupt this show for just a really quick message. I don't know if you know yet about my book. Probably if you've been around, you have seen this and know about this. If you haven't yet got a copy, you can get your own copy signed by me at readunexpected.com. Again, readunexpected.com. It has tons of resources for those of you going with complex and chronic illness. And I hope most of all that it's an inspirational story. You might want to take it to the beach, take it on your next vacation. You can also find it dictated by me, recorded in the studio on your favorite audio device like Audible or Spotify. If you have a Spotify membership, I think this is free. So take a peek, check it out, let me know what you think, and let's get back to the show. That makes so much sense because I deal with a lot of patients, as you know, that have some sort of immune deficiency or chronic infection and autoimmunity. They go together, right? And they're kind of counterintuitive because you're like, oh, wait, how is one side of the immune system like fighting, flu or viruses or something a little bit downregulated, and yet they have autoimmune conditions. And I've seen treatments like immunoglobulins, which is usually IVIG, actually do just like you talked about with beta glucans, where they downregulate the autoimmunity and upregulate the immune activity. So that makes perfect sense to me.
Yeah.
Just a side note, because right now we're in the middle of summer recording this, but people listening might be listening in the middle of flu season or whatever. I'm assuming that beta glucans are really great to fight, like you said, with your toddler bringing home infections and stuff. Would it be something you take all the time or just on the onset, like flying or exposure, or how would you actually take a beta glucan?
Yeah, there's both acute usage and more prolonged usage. Typically, prolonged usage would be a lower dose.
Hmm.
So many people will take, 100 milligrams or so of a good product and take that even really throughout the year, given some of the other
Yeah.
benefits. Some people will cycle it, other people will take that. Now, the acute, and this is how I love it, is when you are going to be exposed, if you're flying, as you
Yeah.
mentioned, just going to a conference
Right.
or that your kids are sick or you're at the gym, and people, whatever it might be, and there's a lot of people around there sick, or just during cold and flu season, to increase that dosage. I mean, there's lots of studies. If you look at respiratory tract infections, there are many clinical trials in that area running across the lifespan. So even from kids,
Yeah.
so they've done something I've done with our little guy, you can take them out of the capsule, put in a little food, doesn't really have much of a taste,
Hmm.
through the kind of like young adult athletes. That's why I
Yeah.
first got into it. And then even older adults. So it's been across the lifespan. It's been shown to decrease the incidence of respiratory tract infections, fewer like sick days, missed days, and those types of things. So there's a lot of good evidence for those purposes. I think taking something in the range of 500 milligrams to a gram a day
Hmm.
is a good thing to do. And typically, you give yourself about a week. So when we're entering cold and flu season, a couple weeks,
Yeah.
say, all right, here's what I'm going to amp up what I take, and then you can back down, once you get out of it.
Okay, that's super helpful. And in clinical practice, and I'd love to run this by you because I don't know that I'm doing the right thing, but in my more complex, especially cancer patients, sometimes I'll give them up to 500 a day. Would that be appropriate in the science?
Oh, yes, yes.
Okay.
So I mean, again, a lot of clinical trials have looked at beta glucan. Sometimes it's been injected, but also quite a bit of time it's oral. So 500 milligrams is actually like that's a pretty solid
Standard.
dose. So
Okay.
that's been well studied, and they've looked at it for both solid tumors, so lung cancer, gastric cancers, breast cancer, and for also for lymphomas, so CLL, for example. And at a 500 milligram dose, you can go higher, but that's
Yeah.
a pretty good dose. Yep.
Okay, got it. So for the average everyday athlete or whatever, 100 a day, long term is really safe, maybe even 200 a day. When you're jumping on a plane or getting exposed, or you just know that your kids are all sick, maybe 500 twice a day for up to a week. And then this middle range where someone's like really dealing with a chronic complex issue, they could easily do 500 a day, a little bit longer term, like if they had cancer or something like that.
Exactly. Yeah, that's a pretty good. And then there's other things you can do too.
Yeah.
We even got a little protocol of other things that we add in. Just some of the other things you think of: C, D,
Right.
zinc,
Oh yeah, I've got
monovitamins.
my COVID protocol was C and D and zinc and quercetin and NAC, and I like, yeah, I'll use that for
That's a great
almost
one.
everybody.
Yeah,
So,
exactly, exactly.
oh,
That's
that's
going to help
good.
for other things too, obviously. But yeah, and I tend to take it throughout. Like, I'll take that higher dose kind of throughout cold and flu season.
Yeah,
Then this time of year have backed down. Just don't feel that I need
right.
it as.
Okay. So you mentioned in your story as an athlete, and I think it's interesting because if I think about a lot of the athletes I know and trainers and, patients who are, sometimes that high level, especially if you are training for an event or something, is suppressed. Well, initially you get cortisol going up, but then you are kind of that cortisol is maybe suppressing immune system. Or some people I see with, say, we're testing secretory IgA, I see a suppression, which is basically showing me there's some sort of a stressor in this person's life. So stress in the immune system, do you want to describe like how that is affecting the immune system and why stress is a big deal for you fighting off infections and how beta glucans can be helpful when you're under stress?
Yeah, 100%. I mean, you mentioned cortisol.
Hmm.
So, I mean, think about it. When there's an organ transplant and we want to minimize the risk of rejection, we give high dose,
Yes.
corticosteroids, right? So, and to a lesser extent, when we're in a high cortisol state due to emotional stress or physical stress. I mean, I think one of the
Mhm.
things for me is actually back down on the intensity of
Yeah.
stuff. Now, if someone's like an elite athlete and it's their profession, then okay, you do what you got to do. But for a lot of us, I think we could actually get away with doing less,
Hmm.
but that's another story for another day. But yeah, so by that excessive cortisol, that's going to lead to diminished immune function and just a state of stress in general. I mean, I think a lot of what we do now is like, how can for like trying to perform optimally, how can we manage that stress? So, one of the ways, so with beta glucan, how it relates to that, there was actually a really interesting um, systematic review of meta-analysis published this year in the European Journal of Clinical Nutrition that looked at, I think it was like 15 or 16 randomized double-blind placebo-controlled trials that looked at not your classic things like cancer or respiratory tract infections, but looked at vigor and energy levels and mood and found statistically significant and clinically meaningful improvements in all of those really tight confidence intervals, which you want to see. So this is like quite suggestive that there's something there. And there's also been studies that have shown reductions in anxiety, and a lot of this is likely mediated by a combination of lower cortisol, which we've seen in animal models with beta glucan supplementation, but also probably something having to do with the gut. I mean, we know that beta glucan is a powerful prebiotic.
Oh,
So when you start having good things going on in the gut, that's we know how much that dictates what's going on in our brain and our just our overall health. But that's a pretty interesting area too, if you want to talk about that.
Oh my goodness, gut is my favorite thing to talk about. Everybody who listens knows I always bring it back to the gut. So yes, of course. And I think just framing that is like I remember like microbiome wasn't even a word in the research like 20 years ago when I started. And now it is hundreds of thousands of articles because we know the microbiome is actually this whole metabolic organ that's affecting our risk of diabetes and anxiety and mood disorders. And I could name 100 things that it's related to. So of course it relates to our immune system. And I always describe it as like that's our first interface with the external environment, right? That tube that goes down. So this is a really ground zero for that immune interface. So yeah, talk to us a little bit about how beta glucans, that's really fascinating that they're a prebiotic because we know diversity, the more kinds of diverse microbes we have, the better our immune system. So maybe you could talk a little bit about how this interplays with the gut microbiome.
Definitely, that's one of the exciting. We look at probiotics, prebiotics, symbiotics, and so on. So it's a really fascinating area. So the way that beta glucans are helping in this respect is that they generally pass through the upper GI tract intact and make it to the colon,
Wow.
where a lot of good things start to happen. So basically, the microorganisms in the gut will ferment these, and they'll produce, some of the, as a prebiotic, they'll start to produce some short chain fatty acids.
Yeah.
So butyrate, for example,
Mhm.
which this feeds the colon cells, so provides energy for the colon cells, can help rebuild. You mentioned this is the first interface of our immune system with outside,
Mhm.
whether it's foods or other things that it comes in contact with. So in doing so, this helps build up that gut barrier, and so many people are suffering from gut barrier dysfunction, intestinal permeability, leaky gut, whatever you want to call it. And as we know, that manifests in all kinds of symptoms. Sometimes GI stuff, but skin, autoimmunity, whatever the case may be. So by beta-glucan's ability to help build that and produce these short chain fatty acids, we end up strengthening that barrier. And we've also seen in other clinical studies too increases in probably maybe downstream from that by feeding the gut bacteria, increasing lactobacillus species, bifidobacterium species, and so on. So there's a nice relationship there. I think probiotics have a place for certain, but I think the more we can think about these prebiotic fibers, the better off we're going to be in supporting multiple domains of gut health, and then everything that's downstream, or I guess mostly upstream directionally, but downstream when it comes to the relationship of our health.
Gosh, love that, Chris, and so well spoken. It's so interesting because I just spoke in London on the gut-brain connection, and when I was, doing the research for the presentation months ago, I was just again astounded at how important those short-chain fatty acids are because they can produce GLP-1, which we all know the popular drugs for weight loss. We did many people listening, you probably know this, but if you don't, your body naturally produces GLP-1. It's an appetite satiation. It helps with metabolism and all the things you see with the drugs, but we can actually make that ourselves. And part of that is when we have more short chain fatty acids, they produce this GLP-1. So I'm assuming the beta glucan has a little bit of role in that as well. Now, one little side tangent that I want to ask about, I deal with a lot of patients with Crohn's and colitis because I recovered from Crohn's many years ago. And one of the things I see is there's a panel of antibodies. There are anti-yeast antibodies like anti-Saccharomyces antibodies and anti-monosaccharide antibodies, and they predict the severity of Crohn's. But what they are is they're actually antibodies to yeast structure. And I've
Hmm.
always wondered if for just those few patients, this is not super common, but for
Mhm.
those who have antibodies to the structure of a yeast, would that be a potential thing we'd have to be careful about?
That's interesting. I would probably, yeah, exercise some caution there. I'll look into that. I've not
Sure.
come across that before, but that may be an area. I mean, nothing's a panacea all the time
Right.
for everybody. That may be an
Just
instance where that's called for, but I'll look into that
yeah,
offline
me
too.
too, because I'm just like
Right.
thinking
Yeah.
out loud and I have no idea. So, and
Yeah.
we'll have to come up with the answer and come back on and talk about that later. But
There you go.
now I know safety sourcing, a lot of companies. First of all, one thing that I tell my patients all the time is you don't have to get products from me, but you want to make sure you have a reputable manufacturer. And I think in the day and age of supplements being, on Amazon and at your local grocery store and stuff, the quality is a huge issue. I mean, I have seen patients come in with lead toxicity and all kinds of things from taking herbs from China that weren't regulated and they had heavy metals and many things. So I do always say, wherever you get them, make sure it's a manufacturer who actually does third-party testing and all that. Let's talk about beta glucans in the industry and like why does quality matter? Where would you recommend? I guess I'll just give you the backstory too, because you and I met
Sure.
through Better Way Health, which
Yes.
I want to talk about specifically because I was astounded at some of their dedication to quality and bringing these beta glucans. So tell us about that.
Sure. Well, first, what sage guidance you're giving your patients and others? This has been an area, so I've been teaching about dietary supplement quality for the last 15, 20
Oh,
years
good.
and came with many of the same conclusions that you did. I mean, how to develop a discriminating eye. It's not just for beta glucan, but for all
Yes,
of them. I mean,
correct.
third-party lab testing is key. Clinical research on the finished product is
Hmm.
another key. I mean, a good white paper can be helpful in providing some guidance, but it's nice to know that whatever we're consuming, has been studied, like put to the
Yes,
actual test. I mean, I always tell, medical students and others, like you value shop maybe on your paper towels or sponges or something like that, not something you're going to put in your body. You
right.
really want to prioritize quality. But it's absolutely the case when it comes to beta glucans without question. And so some of the areas where the products differ. For one is in the sourcing specification. I'm not sure how much you've gone down that rabbit hole, Jill, but it's to me. So I've been involved in raw material sourcing all the way through, clinical trials of finished products, and I have been astounded at the discrepancy in the sourcing specifications for different products in the same space. I mean, if you look at things that when a product's being formulated, they'll look at things like the total molds and these kinds. They'll look
Yes.
at the anaerobic plate count, which is the number of microbes. And I've seen source specifications that for the same ingredient will be 1,000, CFU per gram is how it's measured, to a million, for the same one.
Wow.
So that's what is that, a factor of a thousand
Yeah.
difference?
Yeah.
So it's like you really have to choose wisely when it comes to this. So with beta glucans in particular, a lot of it's going to come down to what is the purity of the product, and it's not linear necessarily. So, a lot of and I'll pull up a
Please.
couple
Yeah.
little images here too. Is that a lot of the beta glucan comes from the same place actually, but different companies require different purity standards of it. So you mentioned the Better Way Health Labs because I've been in beta glucan stuff for quite a while, going all the way back to like my Taki Gold and this
Yeah.
probably 15, 20 years ago. But I was astonished at how they have an 85% purity standard, whereas most others are less than, 70 or less even
Mhm.
sometimes. And that is not like doesn't mean it's 15% better. It's more of an exponential. And I'm going to show some actual
Yeah.
head-to-head studies here on this. One second, and I'll pull this up. Like I wish we had more of this in our space, to be honest. Like I wish there was more head-to-head product studies, in just in general and
Yeah,
natural
Chris, that's
products.
one of
But
the reasons why I'm so sold out on the Better Way quality because as you're pulling this up, one of the things as I talk to you, much of the research has been done third party on Better Way Health because of their quality, right?
absolutely, yeah, and that's what's so interesting about this. So this is all right. Let's get this in slide mode. Okay. So this is Dr. Vedvika. He's basically call him Dr. Beta Glucan.
Oh,
He recently retired, but his career essentially in publishing and science was in Beta Glucan. He has over 80 peer-reviewed publications, which is quite a bit on Beta Glucan alone. And he had no commercial funding for this research, and that's where there's nothing wrong with commercial funding for research, but it's like a step above even when this is done
yes.
either from federal funding or
Mhm.
just with whatever the universities provided to do this. So he led a lot of these studies, head-to-head studies.
Wow.
And one that's pretty interesting, I mentioned some of the studies have been injectable beta glucan. And what he showed, and he and his team showed in this one was that the persistence. So the glucan number 300 is the BWH Labs product, and it lasted effects up to a week, whereas others were 2 days, and some even less than that. But
Wow.
what's interesting is that this question is oral as efficacious as injection, and they found that it was in their studies. So
Wow.
that answered sort of an important clinical question. But what is really interesting is this one, and this is an open access paper that
Mhm.
anybody that's interested in this topic ought to take a look at. And these are the kinds of studies that I just wish we, again, I wish we had more of. Like our team is doing one now for CoQ10 where we're comparing a bunch of different, biquinone, ubiquinol, GG, a bunch of these other forms. But that's exactly what Vedvika and his team did. You'll recognize some of these
Hmm.
names here. And what's interesting is that, just to walk you through this,
Yeah.
the doses on the top here. So
Uh-huh.
ranging from 25 micrograms all the way to 800 in this particular study. And this is looking at phagocytosis. So,
Yep.
again, we mentioned that earlier, the ability to stimulate phagocytosis. And these numbers are essentially just how much it stimulates it at each of these doses. Now, the first thing that I noticed when I read this was, okay, well, the glucan number 300 was the most stimulating at every dosage.
Yes, like
That's
clearly.
pretty
That
clearly.
jumped out to
Yeah.
me right away. Yeah.
Like head and shoulders better. But what's so interesting about this is that even at the lowest dose, so this is a factor of 32. All right. So 1/32 of the dose, it was still getting more than most of the other products under
At the
study.
800, I saw this
Eh, eh,
crazy.
which is just amazing. So, I, you're getting something powerful there. So this is what one of the types, and there's been lots of other markers. We won't belabor the point too much. It's the same with these
Yeah.
other ones too. This is superoxide anion
Wow.
production again. This was both in mouse and human cells. We see that the better weight BWH labs was the most, and then also for nitrite oxide production, the same, pretty considerable margin for these. So this is the kind of testing, again, I wish we saw more of, but that show that, the purity isn't just for marketing or, it actually has a profound effect on the activity. And there have been numerous clinical trials on the BWH labs. I like that too. It's great to have an active product, but they've done clinical trials looking at respiratory infections for cancer, a lot of these things too. So that meets my main parameters for what I look for in any kind of product.
That's powerful. And just for those listening, BWH stands for Better Way Health. If you're listening, we'll definitely have links to get more information. I personally, as a clinician, have switched all of my beta glucans over to the BWH because of this data. Like there's just no refuting the power. And I hands down am having really good clinical experiences with that. So, and I can know that what I'm giving the patient is pure and it works. I noticed on that, and I didn't realize this, but you had two outcomes. One was superoxide dismutase and one was nitric oxide. This is interesting because, of course, nitric oxide affects the immune system, but we think of it as more, at least for me, more of a cardiovascular opening blood vessels and stuff. So maybe that's one of the ways. And you could speak maybe just a little bit, I guess, does beta glucan have ability to increase nitric oxide? I'm assuming.
Yes, it's not been a main area of study, but if you look at again some of those improved cardiovascular outcomes, which we
Yeah.
also know, now that was largely triglycerides and
Uh,
lipids and so on, but yeah, it's another area where we see some promising data.
Amazing. That's cool because I was going to ask you what the future of beta glucans, if there's any other research, and that would be an
Uh,
interesting clinical question for me is like, that one study, if it shows, and then SOD, which is superoxide dismutase, I think about that genetic issue with patients' exposure to like VOCs or chemicals in the
sure.
air and ability to tolerate smoke and fumes and that. And those two things don't to me seem directly related to the immune system, but if that does indeed have activity, those are pretty cool outcomes as well.
It does. And in fact, I'll pull up
Yeah,
another study here. So that's give me 1 second, I'll
sure.
get that for you. But yeah, there have been studies of the BDBH product that showed helping clear cotinine, which is one of the toxins that's in
Oh, yeah.
cigarette smoke,
Uh-huh.
and lower cortisol levels. So this is
Wow.
actually, all right, let's get this pulled up here. Um, and I think about this all the time. And the toxins are and there's some good ways to get rid of them, including beta glucan. So this study here on the left, actually, again, this is also open access. So this looked at those that are exposed, and it's just a sad thing. We see kids that are exposed to a lot of smoke. And we did see in this one decreased cotinine levels and cortisol levels. There's also been some studies, interestingly, that show that beta glucan, it's largely through binding properties that it has,
Ah.
that it binds
Oh,
and
so it's kind of like a binder like we use in mold toxicity.
yes.
Amazing.
Well, exactly. And there have been some recent studies that looked at mold, clearance of mold and even the forever chemicals, the PFOAs,
Yes.
which are just such a I'm constantly thinking about how I can get
Me
rid of those.
too. Plastics and
You know,
PFAS, I'm like, if we don't get our environment under control, these two things are
I
really
know.
dangerous, aren't they?
It,
Uh,
it is really concerning. So that's something. So there's been some interesting studies on the recent one for the PFOAs and again, I think it's largely due to some of the binding properties that they have. And you mentioned, where's the next area? One of the areas we're actually leading a clinical trial right now is on aging. So you mentioned how in longevity, you mentioned how the immune system is at the heart of so much, but that includes the immune system. So I'll pull up we'll do
sure.
one more show and tell, and I think we'll be finished with it. But many of your viewers have probably seen the hallmarks of aging. Let's get this here. We already talked about some of the protocols.
Perfect.
So have you seen this paper? It's like an update on
Yes.
this. Yeah, really, really just fascinating stuff. So this is it was published in early 2023 that expanded this. This is in Cell, which is like one of the top medical
Mhm.
journals. Expanded what had been done maybe 10 years before that into some other areas. And I think all of these are important. I mean, some of them are probably more foundational than others, but these are all, you see these different things here. So epigenetics, downregulated nutrient such as mitochondrial function, it's a big one, of course, and cellular senescence. And some other interesting papers that show it's actually, immunosenescence that is driving, a lot of these aging problems that we have, a lot of the
Mhm.
sequela of aging, whether it's age-related disease or just some of what we consider the aging phenotype. So really interesting papers here. And where we are going, so you mentioned the future. This
Yeah.
is like the quite near future. We are, about midway through a clinical trial where we are looking at healthy adults that are aging at an average rate or worse. So the Dunedin pace is this rate of aging. So one is considered kind of the average what people do. You rate you for each year of your chronological age, you're aging one biological year. Less than that is considered good. I think the best is like in the point sixes. There's those aging Olympics. Have you heard about that or followed that
Yes.
at all?
Uh-huh.
Yeah. So, and what they're using actually is this true diagnostic, which is pretty common in our space.
Yeah.
It includes this Dunedin pace aging rate, but a bunch of other things. These different aging clocks, like the Horvath clock, specifically the immune age, and then methylation of specific immune genes too. So in this study, where we were giving a gram I'm sorry, we're giving two capsules of this for 12 weeks, and we've got our 60 participants enrolled, and we're going to have our results later in the year. But I think this is one of the directions where beta glucan is going to go, is because we know now. We're going to know even more, but how important the immune system is for our longevity. So we're going to look at some specific mechanisms within that context.
Wow, that is amazing because we covered like environmental toxicity and immune system and gut microbiome and I came in knowing about the immune effects, but I'm just even more profoundly surprised by all these other, even nitric oxide. Who knew that there could be a
Yeah,
connection? Which again makes sense because the immune system uses nitric oxide to modulate, so maybe that's the effect. But so
sure.
fascinating. Chris, thank you again for all of your work in this area and for bringing this to light. And even just coming on, you're so clear and concise, and I feel like we've covered so much material. Is there anything else that we've missed or that is you feel like is important for people to know who are listening about beta glucans?
I think you asked great questions and it had a lot of great feedback from your own clinical practice. And I think we hit a lot of the main areas. I mean, it's clear for cancer and immune function, but I think that the big glucan can really be helpful. I think some of these other areas is where I'm really excited about with longevity and
Yeah,
aging and so on. I think it's just gonna be really neat to see when we give our immune system the tools, to better fight to trained immunity that we're going to see great rewards across the lifespan. So I think we hit a lot of it today. So
awesome. Chris, well, thank you for your work. Thank you for coming on. And if you're listening, of course, we'll have all the resources below, but we really appreciate you. Thanks for all that you've done in this field. Hey guys, hope you enjoyed my interview with Chris. I found it to be fascinating and learned a few new things along the way. Who knew that beta glucans could contribute to nitric oxide production? How cool is that? Hope you guys enjoyed this episode. As you know, you can find all transcriptions and episodes on my website, jillcarnahan.com. You can also find them on anywhere you watch or listen to podcasts, Spotify, iTunes, or you name it, it's going to be there. Wherever you're listening to this podcast, could I just ask you for a moment to stop by, leave us a review, comment, let me know suggestions, questions, anything you have. I go in there and check the comments myself, especially on YouTube. So please do that. And if you haven't yet subscribed on YouTube, click that button now, and we'll see you next week for a new episode.